I guess the first thing I would say is that breast augmentation and breast lift just aren't that painful. I only give breast augmentations Tylenol and ibuprofen. They do great for women who have had children. They know what this feels like, this sense of pressure when their milk comes in after giving birth. So once they realize that, they know, oh, this is fine. This is totally manageable. For women who haven't, then we just educate them and say, hey, it feels like a tightness. Tylenol and ibuprofen work best. So it's really a mindset and kind of setting the stage for people to know what to expect. And they do great. Breast lift, not that bad. Easily controlled with pain medicine. But when it comes to tummy tuck, I think that's where at least my practice shines. So that starts with our anesthetist. So they give only medicine through the IV, so propofol and another drug. They don't receive any narcotic during the operation. They don't receive any narcotic in the PACU. Right now I'm at probably 80 tummy tucks, where all but actually 2 now. I used to say all but 1, but we had one last week who said she had a little bit of burning in her incision site. Not bad, maybe 2 out of 10, but 75 tummy tucks, no pain upon awakening. So when you can help people wake up with 0 out of 10 pain and they have not received any narcotic, their receptors aren't primed to want that medicine, it's just better. Okay, then what? Exparel, so long-lasting numbing medicine. So the way that we accomplish painlessness, pain-free awakening is numbing the muscle repair, numbing the incision. And that lasts for about 48 to 72 hours. So are they totally numb for 3 days? No, they're not. But I mean, the edge isn't even the right term. It dramatically decreases pain. Pain used to be the number one thing I thought about. Let's rewind maybe 7 years ago. When I would do a tummy tuck, I would think to myself, when they wake up in recovery, I just hope they're comfortable enough that they can go home. And they always were, but they might wake up in 8 out of 10 pain. No exaggeration. So then they're getting fentanyl and narcotic, and now they're tired. Pain is now the least of my concerns. Zero. I have zero concern for pain. People do great. Exparel and IV anesthesia, total IV anesthesia with narcotic sparing. And then now there's a new drug on the market. I don't know the generic name, but the proprietary name is Narcotics. So this is twice daily. There's a loading dose, so 2 pills before surgery, and then it's twice daily dosing, non-narcotic. I'm going to be very non-scientific about this, but the way I understand it is it blocks the pain signals and people just cruise. So now narcotic is falling like crazy. And I do 1 to 2 tummy tucks a week. Nobody complains about pain. Not really. Not really. Not a big concern. You know, people, in my experience, there's 2 reasons they don't want it. Either it just makes them sick, or they've been addicted to narcotics and don't want to even dip their toe in that water. So I think that both of those patient populations are super highly motivated to avoid it. So I don't make promises that they'll be able to avoid narcotic completely, but given their high desire, they do great. And so it's really not a big deal in my experience so far.